I want you to think about something that happened to you recently. You finished using the bathroom. You stood up, you adjusted your clothes, maybe you took 2 or 3 steps toward the door, and then you felt it. That small, unmistakable dampness. That drop, or maybe more than a drop, that came out after you already thought you were done. You were sure you had finished, but your body had other plans. If that has happened to you, even once, I need you to stay with me for the next few minutes, because what I am about to share with you is something that most doctors never explain, something that most women spend years feeling embarrassed about in silence, and something that is far more common, far more important, and far more treatable than you have ever been told. My name is Dr. Eleanor Whitaker. I have spent over 2 decades working with women going through some of the most confusing and underdiagnosed transitions in their lives. Perimenopause, menopause, hormonal shifts that happen gradually, quietly, and without warning until the symptoms become impossible to ignore. And in all those years, one of the most consistent complaints I hear from women in their late 30s, 40s, and 50s is exactly what I just described. That leak, that post-urination escape, that moment that makes you pause, look down, and feel a quiet, private frustration that you have learned to just live with. But I want to tell you something right now, before we go any further. You do not have to just live with it. And more importantly, it is not what you think it is. The reason this keeps happening has almost nothing to do with your pelvic floor muscles. It is not about how many Kegel exercises you do or do not do. It is not about how many children you have had or how your body changed after pregnancy. What is actually happening goes much deeper than that. And once I explain it to you, I think you are going to look at your body in a completely different way. Let me start by asking you something. When was the last time you felt like your body was fully working with you, not against you, not surprising you, not doing things you did not ask it to do? For many of the women I speak with, that question takes a long time to answer, because at some point, gradually, imperceptibly, things started shifting. The energy that used to carry you through the day started requiring more effort to maintain. Sleep started feeling less restorative. The weight started distributing differently, even when nothing obvious changed about your diet. The mood fluctuations came, the warmth that rose through your chest and face without reason, the moments of forgetting, and underneath all of it, quietly and persistently, these small but deeply uncomfortable physical changes that nobody wants to talk about out loud. Changes like the one I described at the beginning. Here is what I want you to understand. These are not separate problems. They are not random inconveniences of aging. They are all connected. They all share a common origin. And that origin is hormonal. After the age of 35, the female body begins a long, gradual process of hormonal change. Estrogen and progesterone, the 2 primary hormones that have been coordinating an extraordinary number of functions in your body since puberty, begin to decline. This decline is not sudden. It does not announce itself with a clear beginning or a dramatic turning point. It is slow. It is measured in years, sometimes in decades. And it affects almost every system in the body, from your metabolism to your brain chemistry to your cardiovascular health. But there is one area where the impact is particularly direct, particularly physical, and particularly difficult to live with. And that is the tissue of your lower urinary tract. Most people think about estrogen only in terms of reproduction, the menstrual cycle, fertility. But estrogen is not just a reproductive hormone. It is a tissue maintenance hormone. It keeps the lining of your blood vessels healthy. It protects bone density. It regulates inflammatory responses. And critically, it maintains the structural integrity and moisture of the tissues throughout your urinary tract. The bladder wall, the urethra, the surrounding muscle and connective tissue that gives your body the ability to hold urine in and release it fully on demand. When estrogen begins to decline, these tissues begin to change. they become thinner, drier, less elastic, less responsive to the signals your nervous system is sending. The urethra, that small tube through which urine exits your body, begins to lose the healthy muscular tone that allowed it to close completely after urination. And this is where something very specific starts to happen. Something that creates exactly the situation I described at the beginning of this video. In a body with healthy estrogen levels, when you finish urinating, the urethra contracts fully and closes. The signal travels, the muscle responds, and the process is complete. But when estrogen has declined, when the urethral tissue has thinned and lost its tone, the closure is not as complete as it once was. There is a small residual amount of urine that sits in the urethra, not in the bladder, but in the tube itself. And when you stand up, when you shift your body weight, when gravity changes its angle on your anatomy, that small amount travels. And it escapes. Not because your bladder is weak, not because your pelvic floor failed, because the urethral tissue no longer has the hormonal support it needs to do its job completely. This is what I call the S-curve of urethral response. The natural shape of the urethra, when healthy and well supported by estrogen, creates a specific curve that allows it to seal properly under the changes in pressure that happen when you stand or move. When that tissue loses its estrogen-dependent tone, the curve changes, the seal is incomplete, and the result is that small, infuriating, embarrassing leak that happens not during urination, but after. I want you to sit with that for a moment, because if you have been doing Kegel exercises and wondering why they are not solving this, now you know why. Kegels work on the pelvic floor. They do not rebuild urethral tissue. They do not restore the S-curve. And no amount of training a muscle will compensate for tissue that is lacking the hormonal environment it needs to function properly. Now, I want to ask you something. Beyond the leak itself, have you noticed other things? A sense of urgency that comes on suddenly and is harder to delay than it used to be? A feeling that you need to go more frequently? Waking up once or twice at night to use the bathroom when that was never your pattern before. A change in the sensation of your lower abdomen, a mild heaviness or awareness that was not there 5 years ago. These are not unrelated symptoms. They are part of the same picture. They are all telling you the same thing in different ways. Your body's hormonal environment has shifted, and the tissues of your lower urinary tract are responding to that shift. I have worked with hundreds of women who came to me having already seen urologists, having already been prescribed medications that cause dry mouth and brain fog, having already been fitted for pelvic floor devices, having already been told to simply reduce fluid intake, as though the answer to a tissue problem is to drink less water. And every single time, the conversation that had never happened, the one about hormones, about estrogen, about what is actually happening at the tissue level, was the conversation that changed everything. Because once a woman understands that this is a hormonal signal, not a structural failure, the entire approach changes. The shame changes. The sense that the body has betrayed her changes. And the options available to her change. If you have been nodding along to anything I have said in the last few minutes, I want you to know that you are not alone, and I want you to know that this is not something you simply have to manage for the rest of your life. There is a natural method of hormonal support that works specifically on the tissue environment, not just the muscles, not just the symptoms, but the underlying hormonal conditions that allow the urethral tissue to regain its function. Women who have used this method consistently report a dramatic reduction in post-urination leaks, reduced urgency, better sleep because nighttime bathroom trips decrease, and a sense of physical confidence they thought they had permanently lost. It does not replace medical care. It does not work overnight, but it works in the direction that the problem actually exists, at the hormonal root. I will leave the link in the description and in the first comment below this video. Take a look when you are ready. And for now, stay with me, because there is something important I still need to tell you. Here is what most women do not realize about this process. The decline of estrogen is not a cliff. It is a slope, and where you are on that slope matters enormously. The tissue of your urethra, like skin, like bone, like muscle, responds to hormonal support. But that response is not unlimited in time. The longer the tissue goes without adequate hormonal signaling, the more the structural changes become established. The thinning progresses. The elasticity decreases further. The S-curve flattens more. And the window in which the tissue can meaningfully respond to support, while still there, does narrow. I am not telling you this to frighten you. I am telling you this because I have seen too many times women who waited, who thought it would stabilize on its own, who thought the symptoms were manageable enough that they did not need to take action, and who came to me 3 or 4 years later. When the leak had become more frequent, when urgency had become a daily interruption, when sleep had become consistently broken, and when the options available to them were significantly more limited than they would have been earlier. The body is incredibly resilient. At any stage of hormonal transition, there is something that can be done. But earlier is always better. The tissue that has support has the chance to rebuild its tone. The urethral muscle that receives the hormonal signals it needs can begin to close more completely again. The S-curve can begin to restore. This is not a promise of perfection. It is a description of biology. And biology, when given the right conditions, tends to move toward function. I think about the women I have worked with who made the decision to address this early, who did not wait until the leak became a pad, and the pad became a constant, and the constant became something that quietly reorganized their entire social life around proximity to bathrooms, who did not let this small private embarrassment grow into something larger, into avoiding travel, avoiding physical activity, avoiding intimacy, avoiding the conversations that required them to be fully present because part of their mind was always tracking, always calculating, always anticipating. Those women are living differently now, not because they found a miracle, but because they understood the signal their body was sending and they responded to it. Your body has been sending you signals. The leak after you stand up, the urgency that catches you off guard, the nights interrupted by the need to go. These are not signs of weakness. They are not inevitable. They are signals, hormonal signals, and they are asking you to do something. I have placed the link to the natural hormonal support method in the description of this video and in the first comment below. It is a method designed to work at the level where this problem originates, supporting the hormonal environment that your urethral tissue needs to function the way it was always meant to. Take a look today, not next week, today, because the tissue that can still respond is waiting for the support it needs. And the version of you that moves through her day without that quiet calculation, without that private worry, without that dampness that no one else knows about, but that you carry with you everywhere, that version of you is not gone. She is simply waiting for the right signal,